My name is Amanda Cahill, and this is my Anatomy and Physiology 2 Lab Disease project. And the disease I will be presenting today is asthma. Some symptoms of asthma include coughing, wheezing, shortness of breath, which leads to rapid breathing, chest tightness, breathing problems, and an increased heart rate. Other symptoms include frequent respiratory infections that can be caused by allergies, as well as difficulty sleeping. If you are a child that has asthma, you are more likely to have it your whole life, but you could outgrow it. This is called undergoing remission. When in remission, your asthma symptoms are inactive, but later in adult life, you could relapse, which means these symptoms could show back up. The diagnosis for asthma includes tests such as a physical examination of the nose, throat, and upper airways. Doctors also use a stethoscope to listen for wheezing, high-pitched whistle-like sound heard mostly during expiration. Another tool that can be used is a spirometer. A spirometer measures the volume of inspiration and expiration. Other tests include a chest or sinus x-ray, the peak flow test, which measures how well your lungs push air out, the provocation test or the trigger test that makes you breathe into a tube, which is linked to a machine that measures the amount of nitric oxide in your breath. So how to tell if someone has asthma? Asthma is hard to test for before 5 years of age, but the doctor relies on medical history and passing or failing of these certain diagnosis tests I just mentioned. Usually diagnosis can be determined later in life. The difference between someone who has asthma and someone who just has allergies is someone who has asthma experiences intense attacks such as wheezing, shortness of breath, and chest tightness, also called asthma attacks. Compared to someone who has allergies, they do not experience these intense attacks. Some risk factors include infections such as a cold, flu, or upper respiratory tract infections in young children, allergens such as pollen and air pollution, smoking tobacco, which can be inhaled firsthand, secondhand, and thirdhand, that can be a risk for asthma, and cold air or extreme weather changes, and inherited from parents who have asthma. So 3 out of 5 of all asthma cases are hereditary. According to the CDC, if a person has a parent with asthma, he or she is 3 to 6 times more likely to have asthma. The earliest a doctor can test for asthma is 5 years old. The physiology of asthma. The physiology of asthma affects the respiratory system. And so the respiratory rate is the number of breaths taken per minute. So during inspiration, the diaphragm contracts, moves upward, and the external intercostal muscles between the ribs contract and move upward. The thoracic volume increases, interpulmonary pressure decreases, and flows down the pressure gradient until the atmospheric pressure is equal. During expiration, the internal intercostal muscles relax and the lungs recoil. Thoracic volume decreases and interpulmonary pressure increases and flows down the pressure gradient until it is equal to the atmospheric pressure. Hormones included in the respiratory system are epinephrine, which relaxes the muscles around the airways in the lungs and helps dilate and block smooth muscle from constricting in the airways. The smooth muscle controls the diameter of the lumen in the airways. The mucosal layer is for lubricating airways and keeping the lungs moist. The gland in the mucosal layer secretes the mucus that does the lubricating. Although asthma affects the respiratory system, more specifically, it affects the bronchioles in the lungs of the respiratory system. So the bronchioles' job is to create an air passage where oxygen and carbon dioxide can be exchanged. So the bronchioles are the site of gas exchange in your lungs. So when you inhale, oxygenated air is gathered into the bronchioles, and then carbon dioxide, which the alveoli in the bronchioles collects, leaves the lungs when you exhale. The sympathetic nervous system dilates the bronchioles, and the autonomic nervous system constricts the bronchioles. The pathophysiology of asthma includes compared to normal functions of the bronchioles, where airways are open and gas exchange occurs. During an asthma attack, these airways swell and fill with mucus. They become narrower and gas exchange is harder to occur and breathing becomes harder. So during an asthma attack, the smooth muscle layer spasms, which means they are constricted. The opening becomes much smaller and the muscular layer is thickening. The mucus layer swells due to inflammation, causing further clamping down on the airways. Glands in the mucus layer fill up with mucus that secrete into lumen, causing the diameter to narrow even more. Little bubbles form in the lumen, which causes the pop and crackle sound that you listen to in someone having an asthma attack. So because all of this is happening in the bronchioles, which is the site of gas exchange cannot occur, or it is harder to occur, so the person has more trouble breathing. Treatments of asthma include inhaled corticosteroids, also known as inhalers. So inhalers or inhaled corticosteroids give a puff of corticosteroids to prevent swelling of the lungs and open the airways. Inhaled corticosteroids work by preventing certain cells in the lungs from releasing substances, both glucocorticoids and mineralocorticoids, in the activity that causes asthma. They are stabilized lysosomes to reduce inflammation and the effects are gradual and can take days or weeks of consistent use to see results. So, how to use an inhaler? You put the spacer up to your mouth, you push down on the top, and breathe in for 3 to 5 seconds. Some advantages of an inhaler include a quick and fast treatment option. It improves lung function and allows for quick relief. The disadvantage of an inhaler is when breathing in the medication, it can be lost in the mouth and if your mouth is not fully around the spacer, and it only gives you a short amount of medication. It also will not relieve an asthma attack once an asthma attack has started. Another treatment option are bronchodilators. Bronchodilators are daily inhale of steroids to prevent attacks. Lastly, another treatment option is a nebulizer. So nebulizers are a machine that pump medication out as a mist. You hold a tube up to your mouth and breathe the mist in. It is usually prescribed when someone has trouble using an inhaler. So some advantages of a nebulizer is that it is easier for younger children to use and higher doses are available. A disadvantage is that the dosage process takes longer than an inhaler and you have to sit with a big machine. The time required for this is about 10 to 15 minutes, as well as nebulizers are also very expensive. And that is it.